Good morning and welcome to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist with private practice at Encino, California. We are offering this program through KMET 1490 AM ABC Radio. And I'm here along with my business partner, colleague, and above all, my best friend, Dr. Robert Jaffe.
Thank you for that kind introduction.
It's the truth.
I am Dr. Robert Jaffe. I'm a licensed marriage and family therapist. That's part of who I am. I'm also a certified hypnotherapist in private practice in Encino, along with my colleague, my partner, and my best friend, Dr. Mitra Rashidian. We are here to share with you some of what we've learned over many years of study and practice, the goal of which is to be our loving, authentic, true selves. And we both believe that we come into this world as our loving, authentic, true selves. Some of the qualities that we come in with are we are open, we are curious, we are trusting, and we are sexual. We also have our capacity to be emotionally calm, emotionally connected with others, and also to be compassionate. We even have the ability to be confident. That doesn't mean that we know everything, but that means that we believe in ourselves and we believe in the goodness of life, and we believe that we can have a big impact on how happy we are, and by so doing affect the happiness of the planet. So that's what we're here to talk about. We talk about it on Thursday with Dr. Rashidian's program on sexuality and relationships, and today we talk about addiction, trauma, and codependency, and that's what we're doing here.
Exactly. So we would like to invite you to join us by calling us 951-922-3532. That number again is 951-922-3532. That's live, and we would like to hear from you. And that way we can offer you the programs that you would like to hear about and to help us with that. And you can also visit us on the archive section on SoundCloud KMET 1490 page by going to playlist and click on Heart to Heart. You can also visit us at our YouTube at heart-2-heart.online/YouTube.
Mm-hmm.
So Dr. Jaffe, I know that you're very passionate about the topic of addiction, codependency, and trauma, and the impact of all of that on relationships.
Correct.
So we were talking about some of the characteristics of codependency during past week.
Mm-hmm.
And then, so what do we have today for our listeners and for our viewers?
Okay, so we've been talking about codependency as addiction to something outside of ourselves. When I say addiction, I'm talking about a reliance on things that are outside of us to help us to feel better. Why do we need to feel better to begin with? The only reason to feel better is because we're not feeling good or good enough. So we want to change that feeling state and feel better. But the question still remains, why are we not feeling good to begin with? And unfortunately, most of us struggle with some form of codependency because the idea of codependency is the same idea as what we would call a dysfunctional family system. Most of us come from some sort of dysfunction. It's not an all or nothing thing. It isn't where we come from dysfunction or we come from functional or healthy families. There are problems in most families. I'm not going to say every family, but in most families, And the basic problem, of course, is what you and I have been talking about, which is the two parts of the human being, which is the ego and the spirit. And the ego is about connecting with survival. So the ego is about survival and everything that revolves around survival, which is most of the things that we take an interest in, our jobs, our relationships. We feel as though if things aren't going well, we feel anxious and we feel scared. And that has to do with feeling like it's at a deep level, like like things aren't going to work out, and ultimately it goes to the idea of dying. We don't think of it usually in terms of dying, but why do we get so upset when somebody cuts us off on the freeway, right? It's not because in that moment, I mean, it could be, but a lot of times it's not because we almost get into an accident and we worry about dying. It's because it offends us.
And we need to be right all the time.
And we need to be right. And why do we need to be right? Because that part of us, that's the ego, equates being right with survival. Now, of course, what we're talking about is an unconscious process. People aren't thinking, oh, this person cut me off and they threatened my survival. We just think, oh, this person cut me off, how dare they, right? So we're much more in touch with the anger than we are with what causes the anger, which is an underlying feeling of fear, right? And the fear says, how dare they, meaning they are one up on me. They have done me dirty. They have done me wrong. And so now I'm going to get angry and I'm going to get even. And so now I get angry and maybe I speed up and maybe I cut them off. And now we're in a game of chicken, right?
Yeah.
Right? Who's gonna win?
You know, we see guys that say, "You want to step outside?" You know?
Exactly. Yeah. So all of that is about winning, and winning to the ego is equal to survival. But because it's unconscious, we don't recognize that we're doing it. So the ego is all about survival, winning, and being right. And there's times when that's appropriate, when our lives actually are being threatened, and we need to marshal our assets and not be vulnerable and not show fear and be macho, male or female. There are times in our life when we need to do that. However, in our present society, most of us don't really need to do that, but because of the evolutionary process that we're all in, we all have that part of us that feels as though we need to do that. And when we do that, what we do is we cut off that part of us that is the kind, loving, compassionate, connected part of us. That's the spirit part of us. So codependence is about a fight for survival. And what we do is we feel competitive. And so we're in a one-up, one-down relationship with everybody. And so we're measuring our worth based on other people, how they treat us, what achievements they've done, and whether we're good enough in comparison to them. So what I say is codependence is the unspoken about addiction. We're addiction to being right. It's addiction to the ego. It's addiction to being right, and it's addiction to winning. And when we get into competitive relationships, especially in our close relationships with our friends, our children, our spouses, our partners, we cut off that part of us that says it doesn't matter who's right. All that matters is that we love each other and we're connected, and when we feel kind and compassionate with each other. And that we see in our practice as psychotherapists all the time, where people come in and they argue over who's right and who's wrong. and so being loving and being close and connected isn't within their purview. They can't see that that's what's really important.
And what you just said, took me back to, childhood times and what I see from my clients as well, that, we teach our kids without even knowing about how to, compare themselves and how to get into the competitive mood and how to get to that mood of, I need to be right, right from early on. For example, even, parents start to develop that among the siblings. So examples of that, see how your sister just finished, her homeworks, honey, why don't you do that too? See how she did it and now she's free. So this is kind of we're putting them in one up, one down position already.
Right.
We're teaching them that, one is doing better than the other one. Right? We're teaching them that, life is about competition. If the sister is done it, so she's right. So you haven't done it, so you're wrong.
Yes,
right?
Yes, you weren't wrong, or you're less than.
Or you are less than, yes.
Yeah.
So with that one sentence, even though it comes out, so lovingly, see, honey, your sister just finished all of, her food, her plate is empty. Why don't you eat it? So we don't know that this is what we're doing.
Right.
As parents,
right.
We think we are paying attention, we are caring, and that's our intention, obviously. However, the way a child processes that for himself or for herself, it's the initial stage of developing codependency. And I'm less than, and I need to be right, and I need to survive. And this is how basically and simply how it starts.
Right. So,
or at least one way of it.
Absolutely. And again, I want to say this is when we talk about dysfunctional, what we're really saying is when attention is paid more to the behavior than to the person's feelings and understanding why they're behaving in that way. The person starts to believe that they are their behavior. And then the behavior is then judged as good or bad, as you were talking about, competitive, I'm better than, I'm less than. And that is the beginning of the dysfunction. So, and I've mentioned this before, I have two young granddaughters, and I love when my daughter talks to them about why they're acting the way they're acting. And she makes an educated guess as to what they're feeling based on how they behaved. Oh, you took your toy away from your sister because you felt jealous. You felt like you wanted that, and you didn't care about what your sister wanted at that time. And when she says that to the child is then able, even at 2 years old, to make sense of why they did what they did. And then they can start to say, oh yeah, I wanted that, and I didn't really care about what my sister wanted. Rather than, oh, you can't do that, give it back to your sister, because then the focus is on the behavior, and then the child feels like, oh, I did something wrong, and the child then believes not just that they did something wrong, but that they are something wrong.
They are something wrong.
Yeah,
yes.
That's what we mean when we talk about codependent and dysfunctional families, is growing up in the belief that there's something wrong with you.
Right.
And so that gets in the way of your being able to really understand and appreciate and love yourself, which then translates into difficulties with understanding, appreciating, and truly loving other people.
And I think, the two examples that you and I provided demonstrates that this is the beginning where a person starts to learn, I am what other people say about me.
Yes.
I am my behavior, I am what other people say about me. So then we try to overcome our badness, sort of, if I can say it that way. We try to overcome, show that we are not bad, but then again, we seek approval for other people.
Right. Right. And yeah, and so that's one of the great tenets of the ego is I am my reputation. I am what other people think I am. And then, of course, it's easy for us to get truly offended when other people say, oh, you're not so good at this, or, oh, you made a mistake here. And then we say to ourselves, how dare they? You know, they're trying to make themselves better than me, and I'm not going to have that. And then we take offense, and then we move into some defended stance where we're trying to prove ourselves better than them, or we're trying to defend ourselves and say you misunderstood or this or that, and you're trying to explain away the fact that the other person is wrong about you, and we take that as actually the person is physically attacking us.
Let's talk more about this after our commercial break.
Indeed, we will.
Right. Okay. See you in a few minutes. Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Dr. Mitra and Dr. Robert here. For those of you who are just listening to us, we are talking about codependency, trauma, and addictions and the impact of all of that in our relationships. And please call us at 951-922-3532. You may also introduce this program to somebody that you believe they can benefit from this, the information here. And we are also on YouTube at heart-2-heart.online/YouTube. So, Dr. Jaffe.
Yes, ma'am.
Codependency.
We've been talking a lot about dysfunctional families and what that means. And so right now I want to say that every human being has his or her own worth just for the fact that they exist. We've tried to create an environment in the United States where we hold that belief to be sacred, that each individual is entitled to rights just because they exist. And that means that you don't have to do anything. When you look at an infant, the Yiddish word is kvel, Kvell. Kvel meaning your heart melts, and you look at them in high esteem, and you think, oh, what a wonderful baby. And the reason you do that is because that baby exists. It doesn't mean the baby is doing anything. The baby isn't solving a math equation. The baby isn't learning how to play tennis at a top level. The baby just exists, right? But then as the baby starts to grow up, then we place expectations on the baby as to what they need to do. And usually we do this, with good intention. We're trying to help them to figure out, how to be in the world. But what we do is we put our own expectations on them as to what we think is important, and we don't allow the child to figure it out. And our job really as caretakers of the child is to give the space to the child to figure it out, while at the same time giving the child a sense of security that they have us to turn to if they are struggling. And if we start doing things for the child that the child can do for themselves, then we are disabling the child. We call it infantilizing, meaning that we keep the child stuck in an infant position when the child needs to be able to spread their wings, so to speak. We've been talking a lot about ego,
right,
and spirit. And so what we want to do is we want to give the child, and why are we talking about children? Because the first 5-10 years of life is where the child is very, very impacted powerfully by the people around them, most importantly, their caretakers, and then also going to extended family and friends, and then as they go out in the world, teachers and other people that they meet. But certainly at the very beginning, it's our caretakers. And if our caretakers have certain ideas about what's important, they are going to consciously and or unconsciously transmit those ideas to the child. And then the child is going to absorb that as truth without really understanding whether that fits for them or not. So, so for example, girls are supposed to be very pretty and very attractive, right?
Yeah. And then we're wondering why they become anorexic later on in life.
Exactly. And so the focus then is on the physicality, is on how the girl looks. And so if a girl is more classically attractive, then she's treated differently in the world. And so her self-esteem then often revolves around her looks.
I mean, one example of how we do that, the minute we see a baby girl, that usually they are dressed in a cute dress and outfit, we say, oh my God, what a pretty girl, what a pretty outfit. Right. So that seems to be a compliment. But what we're teaching the child is that they are what they wear, they are how they look.
Yes.
That's the message.
That's exactly right. And so when we're teaching the child that, what we're also doing is we're not teaching the child that how they look is only a facet, and actually a small facet of who they are. Have we seen in the world people that we consider physically attractive, with people with their partner who we would say is not physically attractive? And that often happens. And how does that happen? It happens because we are not just how we look. We are, that is part of who we are. We are our physicality, but it's only a slice of who we are. Now, who else are we? We are many, many other things, right? We are our perceptions, we are our thoughts, we are our feelings, we are our experiences, we are our viewpoints, right? And we are mostly, what we are is our spirit, which is the part of us that wants to love and be kind and connected with others.
Exactly.
That's our authentic true self, but that part can be easily overlooked when we are so concerned about fitting in, because fitting in is to that ego part of us is about survival.
Yeah, you mentioned, we were mentioning parents. However, I want to go one step outside parents, and that's how society also creates, false images about ourselves and codependency. For example, if we ask a 5-year-old, what do you want to do when you grow up? Which is by itself, it's a wrong question, but it is commonly asked.
Right.
They say, I want to become an astronaut.
Mm-hmm.
Right.
Mm-hmm.
I want to become a surgeon. I want to become, something that they cannot even conceptualize exactly what does it mean to be a surgeon or to be an astronaut or to be something at that magnitude, right?
Mm-hmm.
So how do they develop this idea is because when they look at all these cartoons, when they look at all those, animation movies, when they look at other Star Wars or things like that, or the games that they have, where they see, people with high power and in what position, and they can do impossible things.
Mm-hmm.
And there is no boundaries and there is no rules or regulation. So they learn that in order to survive, you have to be like that. In order to fit in, you have to be like that. Right. So they assume those roles for themselves. Oh, if I can fly like that, if I can go to a space like that, then I am, somebody that I can be powerful. And as they grow up, let's say by age 10, kids are really interested into all these, games that they have, online games. And in these games, what they learn about is violence. They learn about these like out of space lives and expectations. So this is how when they become accustomed to play with these games at the level that we see them. Like I know of kids that they play online like maybe 6 hours straight. That becomes their world. That becomes their reality.
Mm-hmm.
Right? And that's how they see themselves, that they need to be, otherwise they can't exist.
Mm-hmm.
Right? So that's other form of how society contributes to codependency of kids,
Mm-hmm.
and having unrealistic expectations of themselves.
Yes. Yes. Yeah. I think yes, that's true.
Yeah.
Yeah, that's true. I'm thinking also that there are games which help children stay focused on collecting things
Right.
and achieving and moving to the next level in the game, and it becomes more difficult. And so it challenges them to be creative in the way that they attack things.
Right.
Because my son was one of those who played on games for 6 hours, but what it taught him was to be persistent.
Right. I mean, I'm not suggesting that all the games
Right.
are negative.
Right.
Right. But
Right.
they are games that, parents come here and they say they don't know how to stop their kids from, continue to play with those games. So there are games that they are very practical, very educational. Like I have seen your grandkids play, look at those videos. Remember, we were there 3 weeks ago and they were watching these videos, which I even enjoy looking at them. Right. So not all of them are negative.
Yeah.
But as parents, we want to be mindful that the game that the kids insist on buying and insist on getting engaged with, exactly what are the content of that and what the content is delivering to them.
And also to find out why the child is interested in that particular thing, which I think it is really what we're talking about today, is to go deeper than the behavior. Right. To look more deeply to see what, in other words, if the child is interested in games where they're killing off other people, what is attractive to them about that?
Well, some of what I know is attractive is because their friends have it too.
Well, yeah.
As simple as that.
Yeah.
Because their friends have it, so they need to have it, so that when they meet each other, they can have the same games to play with.
That's true.
Right. So they need to fit in. That's the one.
Yeah, that's one thing. Yeah.
Right.
Or the need to feel powerful.
Right.
Yeah. Yeah. So I want to go for a moment back to addictions, because that's what we're here, to talk about. And really, what addictions are is compulsive behaviors, right? So compulsive behaviors means that I'm going to do something over and over again, and the reason I'm going to be doing it over and over is I'm getting some payoff from it. People are always looking for payoffs. What am I going to get from this? So let's say somebody is washing their hands all the time, 10 times an hour, 50 times a day, they're washing their hands. What's the payoff from that? And usually when that type of behavior happens, one of the payoffs is they have some anxiety. And the anxiety they are believing has to do with bacteria on their hands, or their hands, transmitting some disease to them. And so they get relief from the anxiety from washing their hands. But because they haven't identified why they're washing their hands, they just feel compelled to do it. It's a form of an addictive behavior, right? So, and we can easily see the payoff when people are using drugs and alcohol, because you get the payoff is you get a sense of euphoria, and you get to feel better temporarily than you felt before you used the drug or the alcohol. The same is true with a process addiction, such as gambling, right? Or sex. You can feel better than you were. And certainly if you have a measure of depression or anxiety, those things can take you out of the depression or anxiety temporarily, and you feel better. So addictions serve the purpose of making us feel better, and everybody likes to feel good, and there's nothing wrong with feeling good. And of course, we tend to judge behaviors rather than try to understand the source of the behavior. And if the source of the behavior is something that's causing pain, then we have to say, well, perhaps the goal of the behavior is positive, but the way that they're going about it isn't so helpful to them.
Yeah, and that's the point that many people from addictive families, they miss. They look at the behavior, they look at the aggression, they look at the negative outcome of what they see, and they are unable to bypass that and look beyond, what's going on that causes a person to behave in a certain way. So our commercial break is here.
Yes, it is.
And then so we can continue with this amazing topic after that.
And please give us a call.
Right.
951-922-3532. Just whatever your comment is, whatever your question is, we'd love to hear from you.
See you in a few minutes. Welcome back from our commercial break. Dr. Mitra and Dr. Robert are here at Heart-to-Heart program at KMET 1490 AM, ABC News Radio. Our topic today is about addiction, codependency, and trauma and impact on relationships. Our phone number 951-922-3532, and we really love to hear from you so we can know exactly what's going on, some of your ideas, and how what we're saying you're going to be using them. I mean, how our conversation here are impacting you in a way that it does. Please let us know. So, Dr. Robert Jaffe.
Dr. Robert Jaffe. So we've been talking about codependency and addictions, and so what I'd like to talk about now is something that is a very, very important part of living and a part of healthy living, as well as a big part of psychotherapy, and that is judgment. The idea of judgment. What is judgment? Okay, judgment is something that runs a lot of people. People become very attached to their ideas, and they have certain ideas about what is good and what is bad, what is right and what is wrong, and they believe those ideas so much that those ideas become more important to them than anything else. And so a judgment is an idea that we have about a particular piece of behavior that a person is exhibiting, and we make a judgment about that behavior, and we take that judgment about that particular piece of behavior as to be validating or invalidating the whole person, right?
Correct.
So a judgment would be if you take a photograph of someone who's crying, and then you show them the picture, and you say, here, this is proof that you're a sad person, right? It's a particular piece of behavior that's being exhibited at a particular time. You freeze it, and then you make a global statement about that person, right? So, and then once you've made that global statement, that person, if they accept that, they are locked into that judgment. So they go, oh, I'm a sad person. And then if the person believes that they are a sad person, then that informs a lot of their thinking, feelings, and behaviors in their own psyche and in their relationships with others. And that is especially damaging when we're young, because the child's mind is unformed and accepts other people, especially their caretakers' view of them, as fact, right?
Exactly.
So like, for example, my mom was raised with her cousin, and my mom was labeled the smart one, and her cousin was labeled the pretty one. And my mom lived with that label her whole life. She never thought of herself as attractive. And I saw the two of them, and I saw them when they were reasonably young. I saw them when they were in their 40s. I actually thought my mom was more attractive than her cousin, but my mom, because she was labeled that by her mother, never saw herself that way. And so that informed a lot of her self-esteem and a lot of her relationships with other people.
Yeah, I mean, and this is something like my earlier example that I told you about. What a pretty girl, what a pretty dress, you know, and or we tell, you know, our kids, you know, boys don't cry, you know.
Right.
And so these are, we are giving them both the judgment at the time, right? When we say that to a child. So you're not supposed to cry. Okay, so if you're crying, there is something wrong with you.
Or don't cry.
Or don't cry. Yes, and also we're teaching them that how to develop, you know, their outlook in life.
Correct.
Right.
Correct.
So with just those simple sentences that we think they are very kind, very loving, very sentimental, but they are actually, you know, opening the door to a worldview for the child, and to learn how to look at themselves as who they are.
Yes.
Right.
And people become very, very scared of other people's judgment.
Right.
And people also are very self-judgmental. And so when you're self-judgmental, you've locked yourself into a particular idea that because you're locked into it, your mind then gets frozen in that belief that that is truth.
Exactly. I mean, some fathers, they have a habit of calling their little girl my princess, right? So, well, that's nice. However, you know, the child learns that they can be less than a princess, or they lose their father's love. I'm sorry. Right?
Yes.
So we need to be very careful instead of giving our child unexpected outlook about themselves. We need to treat the child as who they are and actually become curious about who this child is.
Right.
You know,
right.
Let them explore what they want. Let them understand what they want. Let them feel free to talk about their feelings, their experiences, their fear, their happiness, their sadness. Otherwise, you know, they're not going to be able to learn about themselves. They're not going to get to know themselves as who they are.
Right. And so what we do then is we judge ourselves and we judge others, and we have an expectation that other people are going to do the same for us. And so therefore, we try to conform ourselves. Many of us do try to conform ourselves to what we believe other people are wanting.
Right.
And we call it the pretzel syndrome, when we twist ourselves into a pretzel to try to become who we believe the other person wants.
And at the end of the day, we're not the right pretzel.
And at the end of the day, the person's saying, I hate pretzels.
Right.
Right. So it's interesting. My therapist said to me, you know, you might as well be who you are because everybody else is taken. Right. And so who are you? And who you are is not someone who is static. Who you are is an energy that is growing. So who you are today is not who you were yesterday. Although, when I say that, that's only a part of the truth. It's not like the whole truth. In the book The Prophet, which I love, one of my favorite books by the author Khalil Gibran, he said, say not, I have found the truth. He said, say instead, I have found a truth. Because there are many truths, and some of them are contradictory, and yet they're still truths, okay? One of those truths is that we are all living and we are all dying, right? Because that's true, right? From the moment of birth, we move toward death, so we are all dying. But we're also living. We are all male, and yet we're all female. How could we be otherwise since we come from both? right? So we have traits which we would call masculine. We have traits which we would call feminine. That's just part of who we are. Some of us have more traditionally masculine traits. Some of us have more traditionally feminine traits. Some of us are more equal in both. But does it matter? Does it matter? And so there's a difference between having a preference and making a judgment. It's saying you can say I prefer chocolate to vanilla. That's a preference. But if you say chocolate is good and vanilla is bad, then that's a judgment.
Right.
Right?
Right.
And why do we make judgments? It goes back to the ego. The ego makes judgments because in order to survive, we had to, in the past, figure out what was safe and what was unsafe. Now, we still do, but not that often, because we usually on our day-to-day basis, we're not having to deal with physical survival in the world. But what our ego does is it moves us from physical survival into what we consider to be emotional survival. And so if somebody criticizes us, we respond as though we've been attacked. And then we become defensive as though we have to either attack back or run away or hide.
Yeah, so I want to point out something that you just said. When somebody criticizes us,
yes.
Right? So that's a personal attack.
Well,
right?
No, that's what we're perceiving,
right?
As
exactly,
a personal
as
attack.
A personal attack. So it starts with how we are approached. Right? If you're approached in a kind and loving way, even if there is a critic about what we do, if that's been pointed out in a kind and loving way, we don't become defensive. Right.
Well, we might.
We might, but
It depends.
The intensity of that is different.
Correct. But what I'm saying is the reason that we become defensive at all is because we feel as though we're being attacked.
Right.
Even what you just said is when someone criticizes, they're attacking us. They're not attacking us. People can say
it depends on how it is said.
It doesn't matter how it's said. They're not attacking us. That doesn't mean that we like the way that they're treating us, but they're not attacking us. All they're doing is they're giving us their view, which is a strong view. That now we can feel attacked, and we do feel attacked depending upon how strong, how much we believe in ourselves. When we believe in ourselves completely, and very few of us do, we're all on the scale. But when we believe in ourselves completely, if someone says, you're a piece of crap, you're ugly, you're stupid, we say, yeah, that's what you think.
Yeah, that's what you
think.
That's what you think. Yeah. It's a reflection of how they see the world. Yes.
Yeah.
I completely agree with you, but that comes only from that reaction of, okay, but that's your opinion, comes from a person with good self-esteem.
That's what I'm saying. When you believe in yourself strongly,
right.
Yeah. And when you don't believe in the more you don't believe in yourself, the more you feel as though somebody is actually throwing a punch. And then you respond in like ways, and actually it can lead to that. When people are very, very insecure, if someone says something to them they don't like, they can actually throw a punch.
Right. And we have seen that's one of the times that we say, let's step outside.
Exactly. Exactly.
And then women do that to each other in a different way.
Right. Women don't throw the punch, but women throw the punch energetically. Right. They turn their energy into powerful anger or revenge.
Right. And I mean, we see gossip comes from that. Jealousy comes from that. Right. So there are many characteristics that comes from that. And guys, they like that physical, fight, and because they have learned that that's what boys do.
Correct.
Right.
So how does all this relate to codependency and addiction? Codependency comes from dysfunctional families where the behavior was focused on more than the feelings and the reasons why the person did what they did.
Right.
And therefore the person felt judged, felt insecure, and then adopted a certain way of behaving in the world, which had to do with losing their authentic true self and moving into what we call the adapted self or the codependent self. And that's all the roles of the codependent self, which include being the victim, being perfectionists, being overachievers, and of course being people pleasers, rescuers and fixers, and of course being addicted.
Right.
Yeah.
Right.
Yeah.
So, it's what I have learned to do is across the many years of my life. And of course, I owe it mostly about, my training in psychotherapy and research. I have learned to look beyond the obvious.
Mm-hmm.
Right. We see a behavior which is not pleasant, which is not welcomed.
Right.
But there is an underlying cause of that behavior.
Right.
Right. And that's what we need to focus on, not what we see. What we see is a signal that something's not working right.
Yes, yes. But that is an evolved stance.
Right.
It is the stance I want to tell our audience. If you adopt this stance, you're going to be in the minority, because the majority of people are still into punish the behavior. And of course, we know that when we punish the behavior, our ego feels justified.
Right.
So then we can justify punishing somebody and doing all sorts of bad things to them, including killing them, because we demonize them, because we judge them, rather than saying this person is doing harmful things, and yes, we need to protect ourselves and perhaps isolate them, but they're human beings and we can attempt to re-educate them. That's the idea. That is the evolution of where we are moving toward. That's the idea that we've started to get in our society, where we're trying to modernize prisons and create educational programs for people so that they can learn to feel better about themselves. But for the most part, we are still locked into our ego and revenge.
Yes.
Right?
So we would like to continue this conversation next Friday, same time at 9 o'clock. And also I would like to invite you to stay with us, join us on Thursday at 3 o'clock for sexuality and for addiction. Until next Friday, happy 4th of July. Stay safe. And don't forget, all you need is love.
All you need is love. Bye-bye.